Fenton. I'm joined with Dr. Jan Carney and Dr. Kelsey Gleason of the Robert Larner College of Medicine Public Health Programs. We have a full agenda today, and we're going to hear quite a bit of information from Dr. Carney and Dr. Gleason. But first, just wanted to kind of center back as to where we are today. Just this past week, many states have confirmed and presumptive cases of the coronavirus. There are now 13 states reporting cases. As of just this afternoon, as we know, the CDC provides up-to-date information several times a day, and just this afternoon they had reported 99 cases, which includes presumptive positives and CDC confirmed positive cases as well, 10 deaths as a result of the coronavirus. Interesting, 33 of those 99 are travel-related, 20 are likely person-to-person, and then 49 of those 99 are under investigation, which means state and public health officials are investigating how these people are infected. And we're going to learn a lot today from Dr. Carney and Dr. Gleason about that process. And the interesting thing, too, is that states now are also testing and confirming those cases and then confirming with the CDC as well. We will expect more cases. That's really the reality of what's happening with this virus, and most likely a mixture of travel-related, contact-related, and community-associated cases. As I've mentioned, we're going to hear from Dr. Carney today and Dr. Gleason about what is the coronavirus, how these viruses spread, in addition to what actions the Department of Health, the Vermont Department of Health, in addition to the CDC and the World Health Organization, what are they doing? What do they take? And the incredible importance of individual actions to be able to keep yourself and your family and your community safe. As I mentioned, we have a full agenda today, and these are just the quick topics that we will be going over today. And one of the things that I'm already seeing, thank you very much for putting comments into our chat box today. We will be monitoring questions throughout the presentation, but in addition, we are also going to try to hold most of those questions to the end. Dr. Carney and Dr. Gleason have a lot of information to get through today, and we'd like to hold most of those questions to the end. We will allow for that question and answer period in addition. So who is with me today? I feel like everyone should know Dr. Carney. She was the former commissioner of Vermont State Department of Health, but now in your role, you are the Associate Dean for Public Health and Health Policy and a Senior Advisor to the Dean at the Robert Larner College of Medicine, a Professor of Medicine, and a Director of our Graduate of Public Health Programs. And we're so happy to have you with us today. Thank you, Dr. Carney. And Dr. Gleason is with us in addition, an Assistant Professor of Medicine in UVM's College of Medicine in the Public Health Programs. Thank you so much for being with us.
Thanks for having me.
Yeah, we're happy to have both of you here today. So I'm really going to turn the floor over to Dr. Carney and Dr. Gleason to walk us through kind of what we had in the agenda. What is the coronavirus? How does it spread? Really share information so that our community members can be informed and feel safe in their community.
Great, thank you. Let's start with the coronavirus and what is a coronavirus. And you can see the picture that you might see often that has things that look like little crowns on the surface of the virus. Under there is a link from the World Health Organization, which we're going to remind you that is a great source of current information about coronavirus disease 2019. And that's a short video that gives a little bit of the history. But I'm going to turn it over to Dr. Gleason now.
So I think what's on a lot of our minds is, what is the coronavirus? So coronavirus is a large family of viruses. And COVID-19, which is the virus that we're currently seeing here across the globe, is just one in a family of genetically related viruses. What we know about coronavirus family is that the coronavirus originates in animals. And what makes this virus, COVID-19, unique is that in the past 2 decades, we've seen 3 different strains of coronavirus jump from animals to humans. We saw it first with SARS, severe acute respiratory syndrome, and then we saw it again in MERS, so the Middle Eastern Respiratory Syndrome. And now we're seeing it again with COVID-19. What makes COVID-19 unique is not that it's a zoonotic disease. So in fact, approximately 3/4 of all new and emerging diseases now are zoonotic of origin, meaning that they originate in animals. So that's nothing new here. The coronavirus in general is also not particularly new. In fact, the common cold and the seasonal flu that we see every year is a coronavirus strain. And so if you go to the next slide, Nicole, you can see some important differences and similarities between the common coronavirus, such as the flu, and COVID-19. So one of the main differences that we see is symptoms. Symptoms are similar across these different types of coronaviruses, but with the flu, with a common cold, we tend to see mild to moderate respiratory symptoms. With COVID-19, we're seeing more moderate to severe and even lethal cases of respiratory infections. Interestingly, too, the typical cold or the flu that affects every year millions of people worldwide tends to primarily affect children. Interestingly, COVID 19 is impacting primarily adults who also have comorbidities, which is underlying health conditions that's making them increasingly more susceptible to COVID 19.
And so we're seeing pretty widespread. I feel like it starts in one area, and you'll talk about how does something like this spread, and so rapidly.
Right. As you know, we live in an increasingly global society. I think everyone knows that COVID 19 started in Wuhan, China, but it has rapidly spread from Wuhan to almost every nation and certainly every continent. And that's of concern because the rate of growth and spread of this disease is happening really rapidly.
Yeah.
Encouragingly, though, we are seeing that the actual rate of disease spread in China itself is getting to be under control. That's encouraging because we know that public health interventions are possible and they're effective. And so while we see that this disease is spreading really rapidly across the globe, I am encouraged as a public health professional that we can get it under control.
And we're seeing it here in the United States.
Yes, here in the United States, and as you mentioned, many of these cases so far are travel related, but you can look at the map and we see particularly severe numbers of cases recently in Washington State and California. And we see the states around Vermont. We don't see Vermont yet, but Vermont has and is prepared as if it will be here. And that's because of our Department of Health is in close contact with the Centers for Disease Control and Prevention. And that's a good thing. These are the numbers to date. And this is updated really from the CDC website. And that's going to be one of the sites that we recommend people look at regularly for high quality evidence-based information. And this is updated every day at about 4 o'clock in the afternoon about any new developments in our country.
And so what Kelsey was talking about as well is the disparities in terms of, do I have a cold? Do I have the flu? Is this something more serious? How do we help people be able to disseminate that information and make the right choice?
Well, let's talk about the symptoms in terms of the risk for your symptoms of general symptoms of fever and cough and maybe shortness of breath. That might be things that you see with a virus, a cold, a severe cold, the flu. Many things. And they're very non-specific, we call them, because you really can't distinguish them based on the symptoms. Well, epidemiologists and other public health professionals and physicians and nurses are looking at, what is your history of travel? Have you come back recently within 14 days from one of these affected areas? Have you been in contact with someone who's been diagnosed with COVID-19? Or are you a healthcare professional who's working closely to take care of patients? But these are the symptoms. And as Dr. Gleason mentioned, that we're seeing the early parts of the epidemic in China, we saw that really people who were older, many people who were older were more seriously impacted. But we're really monitoring this because we really don't we see the tip of the iceberg, but we don't really know well the full spectrum of disease. Again, very mild infections, and if people can spread things when they don't have symptoms at all.
Yeah, that's a really good point. And I think most people we see so many different reports and we see so many different ways that people are reacting to this information. Walk us through, how does something like this spread?
The transmission of COVID-19 is thought to be through respiratory droplets. So that means it's not airborne. In order for a non-infected individual to catch COVID-19, based on the information that we know so far, someone would need to have an infection and then cough or sneeze on an uninfected individual. So something that you can do to prevent that is staying home if you're sick. If you do come into contact with an infected individual, even if you think that they just have a cold or the flu, keep a distance. Keep a distance of 3, but preferably 6 feet away from them at all times, and wash your hands. Another important way to protect yourself is by cleaning surfaces. So, though the spread of COVID-19 is respiratory in nature, respiratory droplets can survive for a short amount of time on surfaces. So, it's important to keep those clean as well.
Yeah, that's a really good point too. And I saw an interesting article in New York Times, I think yesterday, that said, stop touching your face. I
Oh,
think
you're
it's
right.
something
Hard.
that we all do so unaware that we're doing it. And just, I think it's causing us to be mindful of that and be more aware of it. And so, Dr. Carney had added this slide to the presentation because we do see a lot of, and I think we've seen reports of shortage of
Right,
masks.
right.
Is that something that people should be doing?
No, no, absolutely not. And the question comes up all the time: should I go out and buy a mask? Should I wear a mask? No. Look at this picture, and the reason is the primary reason is it doesn't work. And if you look at this picture, you see the masks on these individuals, and they're hanging down around their ears, and you can see that any of the air they're breathing just comes in around them. What are masks good for? Masks are good when someone is sick, they cough into them, all right? So that prevents them from spreading their infection to other people. But those masks to protect themselves are really not recommended. And again, on a public health scale, we don't want people to be purchasing masks and when we really need to have sufficient supplies in healthcare settings pretty much everywhere. So no, but the primary reason is they don't work. So there are a couple of suggestions as to when to use a mask, and this is, as an example, if you have an illness or a suspect illness, and you might call if you traveled from an area and you have called the health department, they've instructed you to stay home. You call your healthcare professional's office, your primary care professional, and then you're going to go into that office. They might instruct you to wear a mask. Call first and wear a mask. And in healthcare settings, healthcare professionals are trained about how to effectively use one, and they have something called an N95 mask, and they have those fit tested to their face to make sure that they actually prevent the surrounding air from coming in. But that requires training. It's not for the general public to wear just to protect themselves.
Interesting. And I think we see a lot of that happening as people are traveling and trying to be cautious. And rightfully so, they're trying to protect themselves and their family. But there's proper ways, I think, to approach that. And we have this slide here, which I think is really interesting, too, that there's extreme cases where people go.
Well, we're seeing all kinds of things that people think might be helpful. And the question is, does my dog need to wear a mask? And the answer is absolutely not. And here is something from the World Health Organization's website is can pets at home spread the new coronavirus? And no, we don't have any evidence that dogs or cat are getting sick from them. And so we want people to use some common sense around these things.
Great. Thank you. Appreciate that. And I think this is probably one of the most important pieces of information that we can share. Again, we said, what are the pieces that you as an individual, and really individuals can make a difference in this because it's thinking about how do you do proper hygiene, staying home if you're sick, the things that we continue to hear. And so one of the things that I think is really interesting is there's sometimes I think, are we washing our hands properly? Are we washing our hands long enough? Are we getting it all over? And so I think it's a great opportunity for us to think about how do we do this for proper hygiene, not only when there's a virus and a concern, but as flu and various different other viruses are around.
Yeah, that's a great point, Nicole. And the long short of it is no, the majority of us are not washing our hands correctly. Though we all wash our hands, or we should be washing our hands, to properly wash your hands to prevent against the spread of disease, you need to do it for at least 20 seconds. So the general rule of thumb, even though it will probably get stuck in your head, is to hum happy birthday twice. And that seems like a pretty long time when you're washing your hands, but that is a way to most effectively prevent the spread of all diseases, and COVID-19 is no exception. Now, if you're in a pinch, you can certainly use alcohol-based hand sanitizer. Antibacterial soap won't do you any favors because this is a viral infection, but any alcohol-based hand sanitizer that's above 60% alcohol will help you.
And that's a good point, too, because Dr. Carney has a few pieces here. And so it's important to look at, is this sanitizer going to be effective?
Right. We don't want to encourage a false sense of security either. And so make sure that the hand sanitizer that you're using is above that 60% threshold, because now we know COVID-19 is being spread through communities, through individuals. And so it's really up to us as communities, as individuals, to take proper steps to ensure that we do our best to prevent the spread and transmission of this disease.
And there's a video, I believe, too, on CDC that shows,
Right.
says,
Yep.
show, and you
Right.
almost feel silly in terms of like looking at how to properly wash your hands. But I think it's a great opportunity for people to go, okay, maybe I'm not doing it correctly.
Exactly.
And maybe this is a great opportunity to start doing it a little bit more effectively. Big question that everybody is also thinking about too, travel. Either where can I go or where have I come from, and is that something that I should be concerned about? How do we advise people to make the right choices and or to find the right information?
I recommend you go to the CDC website, and we'll see at the end. We'll see the primary websites that we think are the best, the highest quality, and current, up to date, and have really easy to understand, clear information for the public. But if you look on these maps, and they update this on a pretty much a daily basis, and you can look at the areas. The darker colors are the areas that you really should not be traveling to. And as a matter of fact, there's some restriction back into our country, and that it does rapidly change. And so that things, for example, Italy had some community spread and then became more widespread over a period of about 2 or 3 days. These are the different levels that CDC has. And again, those are sort of color coded to look at that. I do think you have to have some common sense there. And this is a rapidly changing situation. So if you see an area that sort of might have some level of spread and you're thinking about going there, maybe consider that that may change in a couple of days, and make sure you're regularly updating that.
And I think some of the things you were just talking about, where are the various different levels? And this would be interesting to share. What is this information that we're seeing here?
Right. This is the information that just shows what those levels mean, and specifically where is CDC recommending that we do not travel, or areas that might be more mildly affected, or we may not know. And part of this, you do have to remember that we don't have the highest quality surveillance system to the same extent every place across the globe. And so we have to look if there are areas that really a broad area is impacted, and another area where there's no information, we need to use some common sense there.
Great. Thank you very much for that. I think these, again, are great tips to be considering, and I don't think we can emphasize these enough. And so I don't know, Kelsey, if maybe you just want to reiterate, if you can kind of think of like the three maybe steps that you personally could be taking, what would you recommend?
I think that the most important steps we've already touched on quite a bit, and Dr. Carney, feel free to jump in, but primarily stay home if you're sick, even if you think that you have the common cold or a flu. Stay home, keep yourself safe, telecommute, work with your communities, work with your employer to come up with a plan. Wash your hands. Washing your hands, like I said, at least 20 seconds with soap will do wonders to prevent the spread of disease. Keeping a distance of at least 6 feet from anyone who is infected will also do wonders to prevent the spread of these respiratory droplets. We know that from sneezing, from coughing, there's only a certain amount of distance that can be done, where damage can be done from the respiratory droplets. And so keeping a distance will help to keep you safe. As Dr. Carney mentioned, masks won't help you. Masks are recommended if you are sick, so they will help prevent the spread of those respiratory droplets. But if you're an uninfected individual, they will not protect you from getting exposed to those droplets. Droplets can get in your eye, they can get in all sorts of different places, you can touch your face. And so it's important not to wear the mask for a lot of different reasons, but the main one is they provide a false sense of security. And as a community, we need to ensure that we have a combined, strong approach to prevent the spread of the disease.
Great.
Maybe,
Thank you.
Nicole, if you could go
Yeah,
back to the previous
sure.
slide, because again, on the end, we're going to reinforce that there's really some great websites that give you high quality, evidence-based information that are up to date. And one of those is the Vermont Department of Health. And they also give advice to patients if you are sick and what to do. And you call your healthcare professional, your primary care provider, you wear a mask, you wash your hands, and then in some cases, if you've been traveling, you're going to contact the health department. So we'll provide that website. Another point I might make is something that Dr. Gleason mentioned about, everybody washing their hands and everyone staying home if they're sick. If we think about it, keeping our communities healthy, if everyone participates and does that, it makes a huge difference
Yeah.
in our community. We not only take care of ourselves and our families, but we also contribute to the health of our entire community.
Yeah.
So I think that's a really good thing that she's mentioned that we want to emphasize.
And really the point is individuals really can make an impact to
Yeah.
help
Absolutely.
curb the spread potentially of this, and that's important to feel like you actually can do something here. And so this is I think a really interesting, and I know this is probably going to be a little difficult for folks to be able to see the details here, and that's probably not necessarily the point you were trying to make, but
Right.
what is in this, this is to me one of the fascinating pieces that I think that you can share with us, Dr. Carney, from your perspective of being the commissioner of the Vermont Department of Health, in terms of the systems that are really enacted and are
Right.
working so hard, from epidemiologists who are trying to understand what is this and how do we solve this and how do we help curb the spread, where did it come from, to the health systems here in our own states and our local communities and the University of Vermont and the University of Vermont Medical Center. All are working to try to understand how to help and how to curb this and be supportive. And so maybe just walk us through what is all those systems and how they work together.
Just a little bit that people may not know that we do have a public health system internationally, globally, in our own state and our own communities. And here in Vermont, it's the Vermont Department of Health. And I would encourage you to visit their website on a regular basis. Their information is accurate, it's up to date, and they are in close contact with the Federal Centers for Disease Control and Prevention. They work very closely with hospitals, doctors, nurses. They give education to the general public. They're in touch with CDC and they're experts there on a regular basis. They provide guidance on laboratory testing. We have a public health laboratory here in Vermont. They also give guidance to schools, institutions of higher education
Yep.
like UVM and other organizations out in the community. And it's a tremendous network of the most dedicated public health professionals. And maybe Dr. Gleason, you might comment on how this relates to the global efforts to prevent this and some of the networks we have in place.
Yeah, and I think that one of the main factors that differentiates COVID-19 from, say, the SARS epidemic that we saw in 2003 is the global response. The global response to COVID-19 has been rapid and has been appropriate. Of course, there have been flaws, there have been mistakes that's been made, and I think that that is unfortunate, but it's to be expected and it's fair. Globally, the WHO is working with governments across all continents to ensure a cohesive and proper response. And so far, that's been really effective. As I mentioned earlier, the response in China has been so effective that we're actually seeing a reduction in the number of new cases. And so I hope that we can use examples from other parts of the globe to improve our response here in the United States as well.
Great, thanks. Excellent point. Thank you very much. I think we've talked a lot about how we do keep our communities safe today, and this is probably more a reiteration of some of the things that you talked about. And the other point that I think you made that was very valuable that I don't think I've heard enough is cleaning surfaces. And so I think that was really helpful for me to hear, and hopefully you at home as well. Here's the other piece, and we showed the piece about animals and should I be worried about my dog. I think there's so many different things out there that people are concerned about or that come up, and in the world we live in terms of how quickly something can turn into a meme or various different things. And so there's a variety of different myths and myth busting that is on the CDC and the World Health Organization website, and we'll include that link here as well. But you had pulled out a few that you wanted to highlight.
Well, let's talk about these, and then people can visit the website of the World Health Organization. We'll provide that to you at the end. But here's one. Does the new coronavirus affect older people or younger people also susceptible? In terms of the people, the majority of people that you're seeing seriously ill, it's been an older population, but that's the tip of the iceberg. So really the precautions and the message are that it is transmissible to people of any ages. And so as a result, the public health recommendations are for people of all ages.
Great. Thank you very much for that. And this is an interesting one, too. I didn't think about this in terms of packages that I may receive, but I suspect people are wondering about that.
Yeah, and I think, we touched earlier on surfaces and how respiratory droplets can land on surfaces and they can survive for a short amount of time. But they certainly can't survive through the mail, and they certainly can't survive in those sorts of climates. And so you should feel absolutely safe receiving packages from China.
Great. Thank you for that very much. This is an interesting one too, and I think that a lot of people are wondering about vaccinations related to pneumonia and flu, and is that effective towards the coronavirus?
No, short answer is no. There are great vaccines that are recommended at different ages against pneumonia, and certainly flu shots every year. These are specific to those diseases, and what is good is the genome of the coronavirus, COVID-19, is understood and sequenced and shared, and so that we expect that researchers are trying to develop a vaccine. That does take time. It would be specific to this COVID-19.
Great, thank you so much. I think this is another myth, if you will, that
Right.
antibiotics might help, and that's not true because this is
No.
a virus.
Antibiotics work against bacteria, and this is a virus we're talking about. Some of the people who have been seriously ill and severely ill, say in the hospital and in intensive care units, if you have a viral respiratory infection, can develop a bacterial infection on top of that, and for them they would have antibiotics, but antibiotics are really not recommended in preventing or treating this.
And I suspect this question is coming up. Is there something that I can take that could help?
No. The short answer is no, not yet. But there are medications under investigation, and those are undergoing clinical trial through the National Institutes of Health. There's a large clinical trial going on in Nebraska. There have been ones going on in China, specifically to look at newer broad spectrum antiviral medications and see if they're effective against this infection.
It's fascinating that how quickly that can be happening when there is a new virus out there. That's really absolutely amazing. Garlic. I found this just really interesting that this was a myth bust. I love garlic, but I wouldn't have thought of it.
Right, and it's not just garlic.
Yeah.
There's a lot of home remedies that are flying around on various media sources, on the internet, and the long short of it is that they don't work. What works is staying home if you're sick and washing your hands. Common sense procedures. Garlic will not help you. Home remedies will not help you. Keep yourself healthy. Keep your communities healthy.
Good point. Thank you so much. We have a long list here of Dr. Carney and Dr. Gleason have referenced many times the CDC website, the World Health Organization website, the Vermont Department of Health as well, the New England Journal of Medicine also you have mentioned, and maybe give us a reference as to why.
Let me mention that. It's sort of, if you want to dig a little deeper into some of the many scientific articles that are being rapidly published, looking at hundreds of thousands of people and cases and situations. That's where you go. They collect those all there. You can learn about the virus itself. You can learn about the Centers for Disease Control in China's summary of 72,000 cases, I think, and what they've learned from that, and more.
Yeah, absolutely. Great. And I know that on our team here, Kelly has been sharing different links in the chat box. And so we will do that as well. And we're happy to share some of the information in these slides. Also, we are recording this webinar. And so we will share this out with everybody who is interested in receiving that information. I also just wanted to touch upon the fact that the University of Vermont is very much monitoring the situation and is probably daily, if not several times a day, in contact with you and Kelsey and the public health department here at the Larner College of Medicine. And so where I want to direct folks, if you do have specific questions related to how UVM is responding and some of the recommendations that UVM is taking in terms of students and parents information, we have a link here as well, and Kelly can put that up into the chat box. It is on uvm.edu underneath President and Division of Operations and Public Safety. And on that, you can find campus communication. So any emails that have gone out related to various different topics, there is a copy of that email so you can see what information has gone out thus far and what dates. And a lot of that information is related to, it's segmented out into travel information, spring break information, study abroad information, and there's frequently asked questions. And of course, there's links on that webpage on UVM's site also to the World Health Organization, the CDC, and the Vermont Department of Health as well. I also wanted to share that University of Vermont Medical Center also has a dedicated page as well that I've included here on this slide that is also talking about the medical center and how is that working and what information that you can have. And all of this information is really kind of circulating around from the same sources that we've referenced many times. But if you do have specific questions as to, if you have a student here, or you're a parent, or you are a student or faculty member, what is the University of Vermont thinking and working in some of those recommendations that we're making here. Thank you both so much for being with us and sharing this information. We do have a whole bunch of questions that have come in.
Great.
So I'd like to move over to some of our question portion. And thank you everyone for being patient and putting those questions in there and waiting until the end. And so we have some good questions related to kind of proximity of things as well. So we have a question here that says, interested in resources that show data from Canada. Many students will be visiting Montreal during the break. Where would we find information related to Canada? Still CDC and World Health Organization, I would imagine.
I think so.
Yeah, so that's really the best source you still feel.
Yeah, the CDC has the best and the most up-to-date sources of information regarding not only travel, but cases that are new and emerging.
We have a question that says, how would you contract COVID-19 from travel if it isn't person to person? Because remember in the beginning, they just separate out. The CDC says, X
Right.
amount of cases are from travel, X amount are person to person. So that's interesting to see how they cross over.
They actually studied that in one of the large studies that I referenced, and this one's in the Journal of the American Medical Association that looked at 72,000 cases from mainland China, and the contacts were very small proportion from those original animal to human kinds of things, and then those were human to human, person to person, in the vast majority of those cases.
Right, and I think that the important distinction here is a lot of transmission that's happening is human to human in the United States, in Italy, in China. But I think that the travel component, where that comes in is, and then you hear in the news all the time that people are diagnosed with COVID-19 and they have no idea where they got it from. And that is because of the huge amount of similarities between COVID-19 and the common cold or the flu. And so people may be affected and they aren't aware of it. We also know that there is a relatively long incubation period. So someone could contract the disease while they were traveling, bring it home, and impact their communities.
Interesting. Thank you very much for clarifying that. Hopefully that helps give a little perspective on your question. We have a question here for organizations serving the public. Are there information posters available to post in our public spaces? I would imagine the Vermont Department of Health has that.
Yes, I would look on the Vermont Department of Health. There are downloadable resources on the World Health Organization, and CDC has quite a lot of visuals as well.
And
all of those places.
Yeah, and what a great suggestion too,
Yes,
in
that
terms
is a
of
great
thinking
suggestion.
about how connected we are in terms of our social media channels. Grabbing that video from the World Health Organization and CDC about washing hands, and how do we help to, in our networks to share this information so that we can help to keep our communities
That's a great
safe.
question. Hand washing posters, those kinds of things definitely are available, and what a great idea.
So we have a question too that I think it's related to surfaces, and I think you may have clarified this a little bit, but let's go back to it because maybe other folks are still wondering what amount of time would potentially the droplets be able to be living on a surface?
So the real answer is we don't know. There is not enough information out there to be 100% certain, but we do know that it's not very long. So we're talking hours.
Okay.
So that's why packages are generally safe. But if you're in an office environment, if you're in your home environment, it's important to keep your surfaces clean and disinfected.
Clean your phone. I mean,
Right.
if you think we walk around and we're going about doing whatever we do, whether we're at work or we're a student, you touch the doorknobs, you do all that. We're telling you to wash your hands frequently. If you don't have access to soap and water easily, carry that hand sanitizer with you. But think about the things that you touch. You touch your phone, so make sure that you clean the case off. You can just use a little alcohol wipe, a couple times a day, something like that, and just common sense here.
Great, thank you for that. We have a couple other great questions coming here From Anne, she says, my daughter-in-law is in late stage of pregnancy and works for UVM Porter Pediatrics at the front desk. Should she be concerned in being in close proximity to patients coming into the office? That's a great question.
That is a great question. And I think that, again, it's difficult to know at this stage, but no, you should not be overly concerned, overly anxious. That's not going to do any favors to preventing the spread of this disease. I think, yet again, I'm going to recommend the precautions that we've talked about many different times. There are certain things that we can do to protect ourselves as individuals. But right now, if you are symptom-free, if you're a healthy individual, you should continue going on with your normal daily life activities.
Yes, this is a new virus, but in terms of when I think about how do you protect yourself against getting the flu from someone who might be in your own work environment, if somebody's sick coming in there, it's the same kind of thing, what we've been talking about, keeping the distance. And if someone is ill, generally they're given a mask, or you want to make sure that they're not spreading it to people in the waiting room, and that we are washing our hands and using hand sanitizer, things like that. But the same way we think about other infections that we commonly come into contact with.
That's a great segue to another question, because we've seen a lot of large events being canceled. And so we have a question here that says several work conferences have been canceled out of abundance of caution, and others have not. Should we be concerned about going through airports?
Again, I think that the answer, we would urge you to check the CDC website to make sure that the airports that you're going through are not under investigation, are not under alarm. But the general answer is no, you shouldn't be concerned. You should be vigilant, but you should, again, go about your daily lives, go about your daily activities, protecting yourself from this illness just as you would protect yourself from another illness like the common cold or the seasonal flu.
This is an interesting question, and I think I'll read it, but I also think that probably UVM's information in terms of the school and the information that they have on the website probably would be the most appropriate. We have a question here from Ethan: are students going to be required to stay at home and not return after spring break due to coronavirus? And I believe that we've got most up to date information, and I think it's still being assessed. But at the moment, the answer is no.
The provost sent out a communication to all faculty, students, and staff about, be prepared. Make sure you have all your work to do over spring break. That if the situation rapidly changes, that's kind of common sense. But we are looking to the university and their website to any update on that guidance.
Absolutely. And we'll share that again, that link in the chat box, to make sure that everybody has the University of Vermont's information related to students and faculty as well. Continuing with some of our questions today, when someone has a cold, when can someone with a cold go back into public? Like, when would you feel like, probably very similar to how we would approach, if you have children at home, and at what point, are they without fever for 24 hours or 48 hours? How would you advise someone if they either have had a common cold or the flu, when they would feel good about returning back?
The incubation period of COVID-19 is not known 100%, but we do suspect that it is approximately 14 days, which means if you are exposed to the disease, you are likely to get it and be symptomatic within 14 days. To answer the question about if you have symptoms already, how long you should stay home for, that's really a discussion that's up to you and your employer, and also your primary care provider. I would highly suggest calling your primary care provider, having a conversation, discussing your symptoms. How often are you coughing? How often are you sneezing? Are you going to be working in an environment where you're in close contact with other individuals?
Yeah, some common sense here for the common cold and then the flu is if you're really ill, you should not be at work. And so you're thinking about getting yourself better and taking care of yourself, and also not spreading it to all your coworkers.
Great, thank you for that. We have a really great question too, that says, for assisted living communities, does the Red Cross have extra supplies, masks, etc.?
I can't answer that one. I don't know. Do you know?
There are national stockpiles of medical supplies that are generally reserved for hospitals or medical facilities should they need it, and I can't speak specifically to the Red Cross.
And I think that question should go right to the health department.
Great. Yeah, that's a great question too. And again, we can put up the website for the Vermont Health Department as well. This is a great question from Jeff because I feel like when we also, it kind of goes back to conferences and large events.
Mhm.
How do you keep safe in an unavoidable crowd such as the New York City subway? Bring this. And that.
Or-
Yeah.
and that one.
Yeah. Any other thoughts on how to do that?
I think it's real life, right? We have crowds in our daily life, and we're just trying to make sure that if you can't prevent everything, but if you're standing next to somebody in the subway who's really coughing, you might want to move over a little bit, and then definitely make sure after you're holding on to those handrails that you use your hand sanitizer when you get off. But I think that we have to go about still living our lives.
And I think too, what we were talking about before is really being mindful of touching your face.
Right.
You know, I
Right.
think we do it
Yes.
so often,
Yeah, I agree with
and
that.
more than anything, it's helped me to be aware of when I've been doing that and saying, "Oh my goodness, I really need to stop doing that so much," because we
Yeah.
just so unconsciously do it.
It's not just your mouth, it's not just your nose, it's also your eyes.
Mhm.
So we need to be really vigilant about not touching our face, about cleaning surfaces, cleaning our hands.
And so another question here that says, my job at UVM Medical Center doesn't allow me to work from home, so I would have to take sick days. Let's see. How do well, I'm not quite sure that we can answer this in
No.
terms of how do you mitigate that process in
No.
terms, and I suspect if there's widespread and there's more concern here in our own communities as things are confirmed here, that there'll be a lot of conversations that employers and employees need to have as to how they approach
I
that.
think that's exactly right. And all the employers and certainly the large employers everyone is taking this very seriously
Mhm.
and preparing and looking at all possibilities for different kinds of occupations. And that is something that people check with their own employer.
Yeah, and I think it's important to reiterate not to stay home if you're healthy. If you're
Mhm.
healthy, you should go to work and go about your normal daily activities. If you're sick, that's when you should start having a conversation. That's when you should start thinking about wearing a face mask so you do not spread your sickness to other people.
Great, thank you for that. And we had another question come in just a few minutes ago about recommended for surface cleaning. And so I think that's something
Right.
that just we reiterate,
Hmm.
and really sharing that information. And maybe as we're kind of winding down, it looks like some of the questions are kind of slowing down today. Let's just kind of go back to those
Yep.
recommendations that you're making for everyone to kind of hear again.
All right. All right.
Either one of you.
Wash your hands with soap and water. Wash them for at least 20 seconds frequently. And if you can't wash your hands, use hand sanitizer.
Hmm. Clean surfaces with something that's based in alcohol, and don't touch your face. Stay home if you're sick. If you are sick, wear a face mask. If you are healthy, a face mask will not help you. Respiratory droplets can get around the face mask. They can also get into your eyes. They can get onto your hands, which you then use to touch your face, touch your eyes. It's best to leave those medical supplies to those who really need them.
Yeah. And I guess my most important message would be to keep up to date, keep knowledgeable. Go
Mhm.
to some of those websites that we've been talking about because they really do have science-based, evidence-based, up-to-date, accurate information that's for the public to help you protect yourselves, your family, and your community.
Great. Thank you both so much. We have the slide up here again of some of those different website links that Dr. Carney and Dr. Gleason have been recommending. In addition, some of the information here for the University of Vermont and the communication that's going out for parents, for students, and for faculty. Thank you, everybody, for joining us today and asking really great questions and listening in and taking thoughts as to how you can help your own individual actions to hopefully curb the spread as we anticipate it may be here. Dr. Gleason and Dr. Carney, thank you so much for being with us today and sharing this information.
Thank you, Nicole.
Yeah, you bet. Have a wonderful afternoon. And again, we will share this recording as soon as possible. And we look forward to any other questions that you may have as well. We can put up our general email address here at the Continuing and Distance Education Department. So if there are follow-up questions, we will direct them to Dr. Carney and Dr. Gleason and try to get you those soon. Have a wonderful afternoon.